Grader in Scouts is now without a troop. The LeRoy teen says it happened when she came out as a transgender girl and was told she could no longer be in the same scouting unit she's been a part of for 6 years. 13 Wham's Carla Rogner shares why the Scout and her mom say this just is not fair. Carla?
Yeah, Jenny, the Boy Scouts of America have accepted girls in its program since 2019. But once they hit middle school, boys and girls are separated into their own troops. When it comes to transgender youth, Skylar Sanders and her mom, Emily, say it feels like discrimination. Skylar Sanders says she has never felt more comfortable in her own skin.
Yeah, I want to just be seen as a normal human.
When she came out as a transgender girl, her family, including her mom, Emily, accepted her right away.
She actually did my makeup.
The two were devastated when they learned it wouldn't be so easy when it came to Skylar's membership in the Boy Scouts of America.
Because of Skylar identifying as a transgender female, that she could no longer attend scouting in the troop, and that there is no troops offered for Skylar as a transgender female.
Emily says she was told Skylar could no longer come to meetings or go to camp.
That was like family to us, because whenever you're with the troop for so long, like you kind of become family.
As of 2017, transgender youth can be Scouts, but they must be part of a troop with the gender they identify with. Where Skylar lives in Genesee County, there is no girls' troop.
The activities are fun together. That was the whole purpose. It is fun together, not fun separated.
In a statement to Wham, the Boy Scouts of America said, "Our Council Scout executives are responsible for working with any family with a Scout who identifies as transgendered and asks for assistance. They work together to locate and register the youth with a scouting unit that best fits their needs." Though Skylar just wants to continue her journey in the Scouts with the troop she knows and loves. I reached out to the Iroquois Trail Council and was told they are trying to work out a plan for Skylar to stay in Scouts, though Emily says she plans to look into legal options.
Baskets will be distributed this weekend. Natalie Kutchko is live at the county's Fleet Center, where testing is underway, to explain just how all of us can get those kits.
Well, Don, Monroe County is among the first in the country to introduce this type of testing distribution. Now, county leaders told us today they're confident this is a step in the right direction in curbing the spread of the virus during this holiday season. With only a few weeks until Christmas, 750,000 at-home rapid COVID test kits are now in Monroe County and will soon be delivered to individual communities.
Not one hesitated and said no. Everybody stood up and said, yes, this is exactly what we need. Thank you for doing this and securing them. It's going to take a community to get these out.
Distribution is at the discretion of each town, village, or city. Residents will be expected to pick them up in the coming days. The tests will be free and were acquired through federal funds from the CARES Act. Monroe County Public Health Commissioner Dr. Michael Mendoza says he's hopeful these efforts will help prevent another COVID surge before the new year.
If every one of us takes a COVID test before going to any holiday gathering, especially where we are indoors and potentially unmasked, a lot of infectious people will know to stay home instead.
He also says residents should expect case numbers to go up as more people get tested. The city of Rochester is slated to receive 100,000 test kits. Mayor-elect Malik Evans is pushing they get put to use.
So the residents of Rochester, before you have that big party, get a hold of those tests and use them. If you're throwing a big party, get a hold of those tests and use them. Let's make sure that we do everything we can to stop the spread of this disease.
And as pickup starts soon, County Executive Adam Bello addressed the rush that will likely occur in getting a hold of a test kit.
The community does need to be patient with us. I know there's going to be a very high demand right away for these tests. I can't imagine it's a one day and done though. So I would encourage all the partners, and we'll step in where we can to help to continue the effort until all the test kits are out. I really want the goal here is to flood the system with tests between now and Christmas.
Now, anyone who tests positive using this method is asked to report it through a form found on the county's website. They can also call the county's COVID hotline as well. Distribution is said to begin this weekend. Many municipalities will have a drive-through setup, again, starting likely this Saturday morning.
Some nurses are leaving their jobs at hospitals, and they're going to travel the country and work at hospitals that need help. Jane Chaco spoke to nurses about why they made that decision. Jane?
Don, with staffing shortages exacerbated by COVID, travel nurses are used to fill the gap, working 13-week contracts and then moving on to the next stop. For some, it's an opportunity to travel, and for others, it's about making more money. Thomas Kahn from Rochester has always loved to travel, working as a flight attendant before becoming a nurse. After a few years at Rochester General Hospital, becoming a travel nurse was the perfect fit.
I have met so many people, amazing patients. The surgeons are just phenomenal. You know, it's almost like you leave a little piece of you every single place that you go. And I have probably the most incredible friends I probably could ever ask for.
Getting to travel for work, appealing for young single professionals. But when COVID hit, the demand for travel nurses skyrocketed, and so did the pay. According to ZipRecruiter, travel nurse jobs in Rochester pay about $4,000 a week, triple the average.
Sometimes you don't like to admit it, but money is a huge factor. You know, as staff nurses, you find yourself being overworked and underpaid.
Annie Maynard applied to be a travel nurse when COVID paused elective surgeries at her hometown hospital in Chautauqua County.
We actually found ourselves not busy. And I mean, me particularly, I was working overnights, and there was just not a whole lot coming in. You know, you hear about all these other communities and hospitals needing help. So I was definitely interested to take my skills elsewhere at that time.
She took a job at Unity Hospital. Providing for 5 children, Maynard says the extra pay was worth a 2.5-hour commute.
That's why it makes sense to us to work smarter, you know, and you know, you want to go where the money's at and where you feel like you're the most use.
There are about 25,000 travel nurses working in Monroe County. New York is among the states that pay the highest for those travel nurses.